if you have a heart condition? What should you do if you have a heart attack or any heart condition? Most importantly, how do you manage heart disease? Also, how can you prevent heart problems from actually happening? Hello and welcome. I'm your host, Dr. Musam Tombeni. Signing with us is Fortune Matlala. Today on Vital Signs, we focus on heart health. Heart Awareness Month is commemorated annually in September in South Africa, and September is dedicated to raising awareness about heart disease and its risk factors in South Africa and the importance of living a healthy lifestyle to prevent disease onset. In this month, the importance of the correct treatment for those who have cardiac-related medical conditions is also highlighted. Heart Awareness Month culminates in World Heart Day on the 29th of September, and coming up in the program, we'll listen to an insert produced by Wandile Mufokeng. He spoke to a cardiologist at the Division of Cardiology at Chris Hani Baragwanath Academic Hospital about how they operate and what services they actually offer. We'll also speak to cardiologists about heart health and how to prevent heart conditions. Wandile Mufokeng also spoke to a dietitian who is going to give us some advice on how we can live a healthier lifestyle with regards to food. And we speak to a health promotions manager at the Heart and Stroke Foundation South Africa about cardiovascular disease risk factors, early detection and diagnosis. Zama Buthelezi is back giving us an update on the latest South African COVID-19 numbers, and Dr. Marlon McKay will answer your questions on COVID-19. Remember that you can be part of the show by asking our guests some of the questions that you have on your mind by simply sharing your views with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us and ask any questions that you may have on social media. On Twitter, it is at SABC Vital Signs, or on our Facebook page, SABC Vital Signs. Vital Signs continues right after the ad break. Welcome back. This is Vital Signs. I'm Dr. Musam Tombeni, and the Division of Cardiology at the Chris Hani Baragwanath Academic Hospital is a large, busy unit treating approximately 15,000 outpatients and 4,000 inpatients annually. The spectrum of disease, of course, is vast and covers congenital, ischemic, valvular and hypertensive heart disease. We visited the clinic to see how they operate and the services they offer. Take a look.
Patients living with heart-related diseases will be pleased to know that Chris Hani Baragwanath Hospital has a full operational cardiac clinic and offers services that can help with their condition. We went for a visit to speak to Professor Richards to tell us about the clinic.
We are a tertiary referral center. We see patients from Southern Gauteng, part of the Northern Cape, almost all of the Northwest province. And as you know, Gauteng is everybody from all the other provinces, including the frontline states, and people that are here as migrant workers with complex heart problems end up here.
Quite a large proportion of patients are referred by their GPs or clinics, but Prof explains that they do welcome walk-ins also.
Because we are surrounded by a whole lot of informal settlement areas, it's not unusual that you get patients walking in through our accident and emergency unit who have got chest pain, have got shortness of breath, who are suddenly found to have a very complex cardiac problem, so they end up with us here to sort out the problem.
The most common heart conditions that are treated at this center are mainly heart attacks and chest pains. Prof explains how patients can quickly get help from the center.
So they would either go to their GPs, and they will end up into our accident and emergency unit, and they will then be admitted, and we then see them immediately or the following day. So they will go through our medical admission department or come directly through the cardiology on-call service. Or they've got chest pain. If you suddenly have a chest pain that is assessed to be due to an ongoing heart attack, you will go through our accident and emergency unit, and one of our doctors will see you, and you will end up in our coronary care unit.
The pandemic has disrupted many health services in and around the world. Prof explains how it has impacted patient care at Baragwanath Hospital.
There was a lot of fear amongst our patients. People were really just afraid to come to hospital. A lot of patients, whether they have heart failure, whether they have had heart attack, they need ongoing treatment and checkup. And, usually we see these patients here on a 6-monthly basis. So we saw a drop in our patient numbers in our clinics during the peak of the COVID waves. And of course, the problem is that then they default on taking their medications. And the result is that if you've got heart failure, if you've got this cardiac conditions, the medications keep you going. It helps to boost your heart, so to say. Now, if you suddenly stop your medications for whatever reason, you decompensate. In other words, you go back to square one and become even worse than when you first started.
According to Professor Richards, smoking and excessive drinking can cause heart problems. He encourages us to either cut down or cut off completely.
Well, don't smoke. And if you do smoke, stop smoking immediately. And if you drink, I know we are probably amongst the drinking, we are number one, among the top 5 drinking countries in the world. We need to cut it down, guys, because booze is also contributing pituitary factor to damage to heart muscles and damage to your heart. So cut it down. Drink socially. Just drink 1 unit or 1 glass of wine or 1 little bottle of cider, once or twice a week. Don't drink until you can't even spell your own name,
After the break, we speak to Dr. Musa Mayayise, a cardiologist, about heart health. Stay with us. Welcome back. This is Vital Signs. Heart failure affects millions of patients all over the world every single year and is a life-threatening condition which culminates in poor quality of life and, of course, the burden of hospitalizations and often premature death. Symptoms are not always cut and dry, as often people find it very difficult to interpret all these sort of symptoms that they're experiencing. In fact, 50% of patients are actually misdiagnosed, resulting in issues of inappropriate treatment or care, the cost to the healthcare system, and, of course, most importantly, the added burden for the patient themselves. Here to talk to us about preventing heart conditions and, of course, what conditions are, we're joined by cardiologist Dr. Musa Mayayise. Good day, Doc. How are you?
Good morning to you, Dr. Musa Mtombeni, and the viewers at home. How are you doing?
All is well on our end. So let's get right into it. Let's talk about the heart and the conditions that exist with it. What is heart disease?
Yeah, so the heart disease will have to, for the purpose of the discussion, divide it into 2. We need to talk about pre-symptomatic or what is called oligosymptomatic. I'll explain that. That is the patient who've got heart disease, but they don't know it. They haven't felt anything. And this becomes a dangerous group because for patients who suffer sudden cardiac death, there's about 50% of them who for the first time before they have anything, then they present for the first time with just a sudden cardiac death. So they were not known before. So that's why it's important to pick up the pre-symptomatic. And then there's a campaign that we're doing now, which is called Know Your Numbers, or Know Your Risk Factors. So this is for the patients who you're well, but you're growing. Then you're supposed to go, then you get a checkup, you check your blood pressure, check your blood sugar, check your cholesterol, and then all those things. And then you also do what the professor was suggesting there, that you need to also make sure you don't smoke. Because if we pick up the diabetes, we pick up the cholesterol, pick up the high blood pressure early, we treat it early, we control it early, we tend to prevent most of the heart disease that we actually get to see later on. Because now you're talking about heart failure in your introduction. If you've got high blood pressure that is not controlled, then it will lead to the damage of the heart muscles, and then the patient comes with heart failure. When we pick up at that stage, then it is already a little bit too late, whilst it can be treated before it reaches there. The same with diabetes, same with smoking, same with cholesterol. If we don't get to control the numbers early on, then what this do, they will damage the blood vessels of the heart, and then later they will cause blockages of the blood vessels of the heart, leads to heart attacks, which may lead heart failure. It may also, unfortunately, lead to death. So we just need more awareness around this. That's why we do the campaign that we do. That's why there is Heart Awareness Month.
So let's get into what we as South Africa look like with respect to the heart care, or what we're doing with respect to our hearts. Do South Africans know if they have heart conditions or not, and how are we looking as a general population with respect to heart disease?
Yeah, that's a big question. I must say, disappointingly, we are not doing very well. Number one, we don't know the basic symptoms, like the professor has already alluded to. Chest pain, if it's not well controlled, if it's getting out of hand, if it's too severe, it could signal the heart disease. If there was shortness of breath, then that can also suggest that maybe the patient is going into heart failure. If the patient collapses, most of people don't really take that seriously, but if you collapse, it can be a very, very serious clue that you are having serious heart disease. So in terms of that, people are not really aware. And then secondly, there is also a problem of misdiagnosis because of not being aware. You know, the patient comes, chest pain, you find that a small, simple test that we call the ECG, which is like a paper which we track the electricity of the heart, we print it out on the paper, very easy to do, and it can just tell us a lot, you know. And then you find that things like that are not really done, and that becomes a little bit of a problem.
So let's discuss the risk factors of someone that might have heart disease. I mean, like you've alluded, you know, you've got two sorts of places in which we find ourselves, where patients are not symptomatic and those that become symptomatic. And of course, that's more the end stage of where we're headed. Let's talk about the patients that actually don't know that they've got heart disease. What are the risk factors that put you at a higher risk of getting heart disease?
And the risk factors are called modifiable and non-modifiable. The non-modifiable are age. As we grow older, we start to have more heart disease. I would say probably at the age of around 30. The age of initiation of disease is now getting younger because of the lifestyle that we have. If we can look at the trend of obesity, which is the one which is pushing up everything else in the heart diseases, has been going, or it's been on the rise, you know. So that with it's also affecting younger and younger children because they sit at home, they play video games, they play with hoverboards, they don't walk around and stuff. So that age group is starting to get a little bit younger. So what we do recommend is that people must get tested. There are wellness at work. There are also opportunistic testing when you go to GPs and stuff, where they can be able to test your blood pressure, test your blood sugar, test your cholesterol, make sure that you lead a healthy lifestyle. If you are sedentary, sedentary just means that you spend most of the time just sitting. If you are living that kind of lifestyle, then you need to get active and start to exercise a little bit. You know, it's recommended that somebody must exercise at 30 minutes, 4 to 5 times a week. You know, and then exercise means that you need to sweat, you need to feel something in your chest. So if you are not doing any of those, you don't know your numbers, get to know your numbers first, then at least you will know what risk profile you have. Then that is what is going to be help people to at least get a start into know what is happening with their heart disease.
All right, so we've got a question here from Kebalipile saying that, hi, Dr. Mosa, I'm 29 years old and I've been getting chest pains. I heard the cause might be heavy lifting of objects or materials and high intake of caffeine. I would want to know from a medical point of view, what could be the cause and what can be done? I am worried. What do you think, Doc?
All right, so chest pain is true. They mentioned a whole lot of issues there that could cause the chest pain. So it's true, it can be from the heart disease. So now let's start with that one. If it suggests a heart attack, what it normally is going to be here, behind the breastbone. Most patients are showed. I think you showed one of the clip of patients holding onto the chest. So that's how it can be. It's called the crushing type of chest pain. Yes, something like that. That normally suggests that it could be coming from the heart. It normally, when you stop exercising, it doesn't go away. You know, it gets worse and worse. And it's much more obvious for patients who have been treated for heart attacks before and then they've got stents and stuff, so that becomes a little bit more obvious. But that's what can be able to suggest that it is. Then there are other issues that can be able to cause, like he talks about the muscles, which can cause the chest pain. You can get things like ulcers and the gastric reflux, acid reflux, can burn, cause that bit of heartburn and stuff. And then those normally also create a bit of a confusion where a patient who's actually having a heart attack, you find that they're diagnosed of having a peptic ulcer disease. So if a patient has most of those risk factors that we mentioned, cholesterol, diabetes, high blood pressure, you are smoking cigarettes, you need to be able to be attended to much, much earlier to make sure that you don't have a chest pain. If you're not sure, go see your doctor and then let them at least take you through the workup and then tell you what it is that is going on.
Doc, let me put it to you this way. Is it important to gauge or say things are more heart-related than anything else as a matter of exclusion so that patients are able to go out there and get the help that they need, whether it's their GP, their local clinic, wherever, instead of assuming that it's something that's less problematic?
That's a big one. Because I think I got a question whether male or female get more problems. We actually get a lot more problems from men because they will get a serious symptom, then they want to think it's something less serious. That's the thing. And that creates problems for us because there are conditions like if you've got a chest pain and it's a heart attack, it needs to be treated within 2 hours of onset. So if you are staying at home, you are trying to drink water, you are trying to relax, you are trying to what? You are wasting a lot of time. So you need to be diagnosed quickly, treatment needs to be initiated quickly, then that will get the most beneficial outcome in terms of saving lives when it's treated much, much sooner. Secondly, things like rhythm problems, the electrical problems of the heart. Some of them can lead to the cardiac arrest, which means the heart stops pumping altogether, and that can lead to death. So some of them can lead to that. So if you're still trying to reason, then it's going on, it's not being picked up, it's not being managed, that can also be a problem. So I would say that if you've got chest pains that you really are worried about, go get see your doctor much more immediately. Call the emergency services. If you can't breathe all of a sudden, call emergency service, go get seen. If you collapse, this is a serious one. It could just be that you survive death. You are now into your second life, you're in an extended life, and please go get help sooner.
Okay, Doc. I've got a question here from Audrey in Mayerton. Audrey, good day.
Good day, Doctor. How are you?
Very well, thank you. You have a question for Dr. Musa, the second Dr. Musa.
Yes, please.
We're listening.
Doctor, I've got a 9-year-old son. His name is Rodosan. So around May, he complained that he's got short breath. And then I took him to the GP because at the time, he was so dizzy, I didn't know what to do. Then we went to the GP. When we got there, they said, no, his heart is pumping very fast. And then we were referred to Park Lane, and then they checked him there. And then when we got there, they said, he's got a leaking valve. But they didn't know whether the valve started on that day or he was born with it, because it was for the first time he had such a problem. So we were never given anything, any medication or anything. And I am so worried to say, what if it happens again, and what is the next thing that will happen? Maybe it's going to be a big thing. I don't know.
All right, thank you, Audrey. I think the doc heard your question. An issue of a young child that had a heart problem, seen at a facility, told to have a leaky valve, so some sort of valve disease, but since then has not been seen, has not been treated. What should we do in this case?
Look, with heart problems, they normally there could be a problem that is picked up. We find that it's not significant, or the problem that is picked up and then it needs to be followed up because it might lead to a time when they need to intervene on it, or it can be the problem that is worse from the onset, of which in that case then there will be much more treatment that is started, there might be surgery that is performed and stuff. So I would say, look, if the child continues to have symptoms, maybe they can go and see a cardiologist and then let them assess and then let them see what it is that the child is going on. And they can also get the reports from the other doctor, so that if they go to another doctor, then they've got reports in terms of this is where we started. Maybe the doctor can be able to see from where you started, this is where you are now. So that's what I can advise on this in this situation.
All right. Thank you so much, Doc, for answering that question from Audrey about the child. Before we get into the last call, very quickly, how do we prevent getting heart disease?
The prevention of getting heart disease is basically, one, choose to live a healthy lifestyle, eat healthy, exercise, and then make sure that you know your numbers, blood pressure, glucose, and cholesterol. And then if you've got any problems in that area, let them get treated. Make sure that you follow the treatment wisely. And then if the issue of weight as well, I know it's a bit of a sensitive one, but we need to try and get to the weight loss type of program. Then those things, they reduce the risk of getting heart disease. So that's what you can do. Smoking cigarettes, it's nothing but an income generator for cardiologists. It's nothing but an income generator for people who deal with lung cancers. So I wouldn't recommend it for any reason.
All right. Last question. This is from Tebogo in Tembisa. Tebogo, what's your question for the doctor? Tebogo?
Hi.
Hi. Yes, we're listening.
Yeah, doctor, I have a problem. This year earlier on May, I was having a problem. They told me that I have a clot in a heart. And later on in stage, they told me that I'm having a pulmonary embolism. Mm-hmm. And I don't know what to do about it because I'm always sometimes having to have short breaths and chest pains.
Mm. All right. Thank you, Tebogo. We heard the question. The issue here that Tebogo has, Doc, is one where she was found to have a clot and has since then been someone that has been told that she might have pulmonary emboli. But now complains of shortness of breath. What do we do in this case, Doc?
The blood flow in the lungs basically affects the blood flow that is going to the lungs, and over time it affects the right side of the heart, and then can cause heart failure in that mechanism. So basically what she needs to do, they need to be able to assess, one, the pressure, the clot if it's still there, two, how the pressure's in the lungs, and three, how is the heart function. So that also can be done by a cardiologist.
Mm-hmm. Thank you so much, Doc, for joining us today. And I hope Tebogo got something out of that. Go out, go get seen so that you can be put on the right treatment for your condition. Like the doctor said, heart disease is one of those hidden ones. It's a secret, it's mysterious, it's living, and you feel like everything is going well up until a point that it doesn't. So if you can go for your regular checkups to make sure that all your numbers are known to you and the people that take care of you, then everything will work out fine. That was Dr. Musa Mayayese, a cardiologist, and after the break, we'll listen to an insert produced by Wandile Mufokeng as he spoke to Bukheleng and Chabeleng, a dietitian, to give us advice on how we can live a healthy lifestyle. See you after the break. Welcome back. This is Vital Signs. Now, to have a healthy heart diet, you need to eat more fruits, veggies, whole grains, and other high-fiber foods. And, of course, choose foods that are low in saturated fats, trans fats, and cholesterol. Those are the words of dietitian Bukheleng Nchabeleng from Polokwane. She sat down with Wandile to give us some advice on how we can live a healthy lifestyle in order to prevent heart disease. Take a listen.
Thank you so much for coming on the program. On the program, we are talking Heart Awareness Month. As a nutritionist, could you just kindly tell us why is it important to look after your body or eat healthy to avoid getting heart conditions?
70 to 80% of heart diseases can be prevented by our healthy lifestyle choices, such as healthy eating. We know that balanced diet or making good nutritional choices is the best weapon that we have in the fight against heart conditions, but not only heart conditions, but other chronic medical conditions such as diabetes, hypertension, renal failure, obesity, and some of the cancers.
How do we deal with those who can't afford to buy healthy food? Because every time you say healthy food, people think, oh, it's expensive. How do you then encourage those who can't afford to go to the supermarket every day to buy fresh veggies? What advice do we have for such a person?
I can say majority of our people can afford to buy bread, for instance. So that's what I'm saying, it's a choice. Instead of white bread, they can choose a whole grain bread, a whole wheat bread instead of white bread. Instead of white flour, they can opt that they can choose the whole wheat the whole wheat or the bran flour. And then, like I said, vegetables are easily accessible, even with regard to protein. Beans is very cheap, it's easily accessible, it's very nutritious. You don't have to go buy red meat, but you can buy beans, you can buy tinned fish, you can buy eggs, you can buy milk. Then it's balanced.
What are some of those unhealthy choices that people usually go for thinking that they're healthy, in your experience?
All right. What they can also do in terms of cutting the unhealthy stuff is just they need to cut down on unhealthy fats. Unhealthy fats, they're mainly found from our saturated fats, which is also animal fat. Like we can get that from your chicken skin. You can get that from your mohodu, your tribe, your processed meat, your polony, your viandas, your sausages. Those foods are very, very, very high in saturated fats. And we know that saturated fat is also an enemy to our heart.
In your own words, what would a healthy plate consist of that will help you prevent getting any form of heart conditions?
They must always remember that portion is everything. Portion is also key. If I'm saying 25%, I'm not referring to a big a mountain of pap or a mountain of mashed potatoes or a mountain of butternut. Just try to make sure that it's equivalent to your fist. You just measure your starch with your fist, because remember, if we consume too much starch, we are at risk of being overweight. And if we are at risk of being overweight or obese, we are at risk of heart conditions.
Olga, thank you so much for your time, and hopefully our viewers have heard the healthy way of living and the balanced plate. So thank you so much for your time.
Thank you very much.
As we know, September is Heart Awareness Month, which is especially relevant in South Africa, given that strokes and heart disease are unfortunately amongst the leading causes of natural death in our country. According to the Heart and Stroke Foundation South Africa, 225 South Africans die of heart disease every day, and yet 80% of heart disease and strokes can be prevented. Rapid urbanization in South Africa has seen a change in foods consumption patterns, where people are consuming more kilojoules, sugary beverages, processed foods, and fewer fruits and vegetables. This, in combination with other rising cardiovascular risk factors such as physical inactivity, tobacco smoking, and other things, have resulted in a steady increase in deaths due to cardiovascular disease in recent years. Joining us to talk about cardiovascular disease, we welcome Health Promotions Manager from the Heart and Stroke Foundation South Africa, Dana Gavender. Good morning. How are you today?
Good morning, Dr. Musa, and good morning to all your viewers.
So let's get right into it. Are South Africans well aware of what cardiovascular disease is?
According to the World Health Organization, cardiovascular disease remains the #1 killer worldwide. Because, due to the lifestyles of our communities, and it causes 18.6 million deaths worldwide. And in South Africa, as you mentioned, 225 people die every day, making cardiovascular disease the second biggest killer in South Africa, next to HIV and AIDS. In reality, the lifestyles of many South Africans is steadily becoming very, very unhealthy. And if you look at the stats around heart disease in South Africa, up to 45% of our adult population are hypertensive or have high blood pressure. 37% of women and 37% of men and 12% of women are regular smokers. And as our dietitian also mentioned, most South Africans eat a high diet of processed meats. Foods have excessive salt, sugar, refined starches, deep fried foods, and not consuming enough fruit and vegetables. And if you look at our obesity problems, 68% of women and 31% of men are overweight or obese. So you can see this is some of the risk factors that are increasing cardiovascular disease in our country.
Okay, so let's talk about screening. I think because this is one of those hidden diseases that you won't really know about up until it's too late, how do we go about assessing and making sure that we can find the people that have these diseases and we can start getting them on track towards, bettering their conditions?
Health risk assessments, which includes blood pressure, cholesterol and glucose, is one of the most important pillars of the Foundation's wellness programs and is our primary tool in ensuring that communities, both the public and the private sector, are taking care of their health. Our risk assessments are very important because it also allows for early detection and care thereafter. And very important to know your numbers, as our doctor was mentioning as well. He has got a campaign, know your numbers. If you know your numbers, then you're able to act decisively in terms of your conditions and if you have a problem, and you can attend to that.
So we've spoken about early detection and why it's important, but how do we mobilize the people in our lives to go out and get tested and know their numbers?
I think it's very important. We have partnered with a number of organizations this year, creating awareness about cardiovascular disease. And as our previous presenters did mention, that up to 70 to 80% of cardiovascular disease that happens before the age of 70 years can be prevented through lifestyle changes. And a healthy lifestyle includes physical activity, eating a balanced, healthy diet, not smoking, also managing stress effectively as well, and having a good weight management system as well.
So with respect to moving on, so you're a person that's got cardiovascular disease, you've been diagnosed with it. How do we improve people not defaulting on the treatment that they have, and also making sure that, they fill all the other brackets that need to be filled about taking care of their weight, taking care of their diets?
I think our main focus is empowering people with education.
Okay.
Information is key, and very exciting project in April this year. We very proudly launched our mobile clinic. This was sponsored by the National Lotteries Commission, where we go into our communities where they do not have access to healthcare or also access to screenings. And this is important because many under-resourced communities do not have healthcare facilities. So the role of the mobile clinic was to visit communities, shopping malls, old age homes, conducting health risk assessments that include blood pressure, cholesterol, and glucose and body mass index as well.
Okay, to wrap things up, let's chat about preventative measures. Once you've already been treated or you are on treatment, what preventative measures can we put in so that disease does not progress to a point that you have a stroke or anything along those lines?
Absolutely. I think it's important, as we mentioned, that heart disease can be prevented by adopting healthy lifestyles. And also, healthy lifestyle also means managing your risk factors, for example, blood pressure, diabetes and cholesterol, and making sure that you take your medication and you don't fault on your medication. That's important, and our presenters also mentioned that. And to know your risk factors. And this is what the Heart Foundation is all about. We are focusing on empowering people so that they know what causes heart disease and strokes as well, so that they can take care of the heart and the brain health.
Thank you so much for joining us today, discussing what the Heart and Stroke Foundation does do in educating all the people that are alive right now and not too sure about whether they might have heart disease or not. Cardiovascular disease, a big, big killer in the world, and we can do something about it. Go out, get screened, and once you've been screened and found to have something, get the treatment that you can and prevent any further disease. That was Dana Govender, Health Promotions Manager from the Heart and Stroke Foundation, South Africa. After the break, Zamabu Teleza will take us through the latest South African COVID-19 numbers, and Dr. Marla McKay is back as we speak about COVID-19 symptoms.
A very good morning to Vital Science viewers. I'm Zama Buthelezi. Nationally, we have exited the third wave according to the current definition. The national 7-day moving average of daily case numbers, positivity rate and testing rate continue to decrease, with sustained decreases seen in all provinces. While all this is great news, remember that receiving a COVID-19 vaccine is a safe way to build protection against the disease. COVID-19 has had serious life-threatening complications, and there is no way to know how the disease will affect you. COVID-19 vaccinations can help protect you by teaching your body to fight the virus without having to experience sickness or putting yourself at risk of severe illness. For now, though, let's take a look at the national COVID-19 statistics. So to date, 17,603,913 tests have been processed in the country. Positive cases, we now at 2,898,888. People who have recovered, 2,765,700, and active cases, we're seeing a decline at 45,771. But sadly, 87,417 people have died from COVID-related complications. New cases, we're seeing a slight increase compared to yesterday, with 1,367 cases reported in the last 24 hours. So what's happening in the provinces? Looking at the provincial breakdown of new cases, the total number of cases today is higher than yesterday and lower than the average number of new cases per day over the last 7 preceding days. Just wondering if the long weekend is not to blame for this, but the 7-day moving average daily number of cases has decreased. Gauteng remains the epicenter of the third wave of the pandemic, with a huge drop in new daily infections compared to KwaZulu-Natal, the Western Cape and the Eastern Cape provinces, where majority of the cases lately come from. And also there has been an increase in hospital admissions. For now, though, let's take a look at the infection numbers recorded in the provinces with big metros. So KwaZulu-Natal in the last 24 hours has recorded 372 cases, followed by Western Cape with 241 cases, Eastern Cape at number 3 with 185, and Gauteng with 190 cases. While the infection rate is finally showing clear signs of declining, Mpumalanga and the Northern Cape are showing fewer numbers of people taking the COVID jab. Hopefully more people can have some courage to go and receive some vaccination. Otherwise, we risk going through the more severe, harrowing COVID-19 trajectory in the future. Remember, the only way to avoid another peak is for everyone to be vaccinated. For now, though, let's take a look at the numbers recorded in the remaining provinces. So Free State has recorded 169 cases in the last 24 hours, Northern Cape 75, Northwest 56, Mpumalanga 55, Limpopo 24. Vaccine registration and inoculation is still open for those ages 18 and over 17,000 people have been vaccinated to date, according to the NICD. We are all urged to register and go out there in numbers to vaccinate to lower the COVID severity and hospitalization. Let us continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. Remember to wear a cloth mask that covers both your nose and mouth even though you're vaccinated. Practice social distancing and ensure proper ventilation indoors. Lastly, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a toll-free number 0800 029 999. and alert them to your symptoms. Remember, protect yourself to protect others. Back to you, Musa.
Thanks so much, Zama, for giving us those numbers. Let's jump right into it and chat to Dr. Marlon McKay, talking COVID-19 and all the frustrations that come with it. Doc, good day to you.
Good day, Doc. Nice to have you. Thanks.
Right, so let's jump right into it and chat around the vaccine. Importantly, a lot of people are staying away from getting the vaccine because they fear the side effects. So, for those that haven't heard what the side effects are, what do you need to look out for?
Okay, so the first thing to look out for is that, number one, everything has side effects. Number two, the most common side effect will be a painful arm at the site of the injection. It's a deep intramuscular injection, so it will cause some pain. Later on, you may get some more what you call systemic side effects. Fatigue is quite common, chills, headaches, body aches and pains. Please, it's short-lasting, it does not cause COVID, it cannot give you COVID, it cannot give you anything except those side effects, and then the side effects settle.
So there are women that have gone out to complain about, their periods changing or the dates of their periods not being the same after having gotten the vaccine. Is this true for getting the COVID vaccine?
No. So the latest evidence does not show, and the data is does not show any link between the vaccine and change in your period. Neither does it cause any change in your reproductive ability. Neither does it cause any changes in your fertility. So it does not cause hormonal changes, and it's not associated with the vaccine per se. Just because it's around the time of the vaccine does not mean the vaccine was the actual cause. It can be linked but not caused.
So a big one that you just touched on now is making people staying away from getting the vaccine. People speaking about, the fake news of erectile dysfunction after you get the jab. Is this true?
Again, these are myths. The vaccine's been available now and been around for long. There's almost 6 billion doses that have been given. And so far there has not been any link found between the vaccine and erectile dysfunction, again, between the vaccine and fertility. So there is no reason to delay your vaccine to see if it's going to happen to other people and to see if they're going to fall pregnant within the next 9 months. Please make sure that you go ahead. You do not have to fear any issues with erectile dysfunction or any other reproductive thing. So
is a wait-and-see approach with regards to getting the vaccine a bad one then?
Absolutely, Musa. You see, one of the reasons is this. If we are suspecting or expecting another wave within the next few months, and possibly by December, for instance, the Pfizer jab, you need 2 doses, 42 days apart, and then you are fully vaccinated, regardless fully vaccinated, 14 days after the second jab. That's 56 days. 2 months. Within 2 months, the next wave could possibly be here. So we do not have time. You need to be protected by the time the next wave comes. So time is of the essence. Please do not delay. Go for your vaccine ASAP.
Let's chat around COVID. So here I am. I've just gotten tested. The result came back as positive. I go through a week of isolation. I'm at home. Nothing too bad happens to me, but I'm an avid blood donor. Should I go out and donate my blood the next week, or when can I go donate?
Yeah, I think the guidance is suggests that number one, wait until you are fully recovered. So at least wait until you've done the isolation for 10 days and you are symptom-free, especially with regard to any temperature. And then after that, probably within the next 2 weeks to a month, just as we say, wait 30 days until you get your vaccine, just so that your antibody levels can stabilize. Then we would suggest getting back into your cycle of donating blood. So rather just wait until you make sure that you are definitely symptom-free before you can go ahead with that.
Message from Kaylin Thompson saying, hi everyone, I had COVID 6 weeks ago and I'm still struggling with exhaustion, headaches, nausea and brain fog. Everything feels so overwhelming. What advice would you give Kaylin?
Yeah, so the diagnosis here is something that we're seeing with up to 30 to 40% of people who have had COVID, and this is called long COVID, the persistence of symptoms more than 4 weeks after the initial acute clinical illness. So the first one is you are not alone, Kaylin. Number 2, please be patient. Number 3, you may want to persist with some of the vitamins that you were given while you had COVID, and then don't let it stop you from getting vaccinated is a good tip. And then number 4, get into a healthy lifestyle. But please don't become disillusioned. Don't give up. It will get better.
All right, another message here from Monopi saying that, can I take the vaccine whilst having discomfort in my chest? It happens mostly after eating, and I've went to the doctor, but it's still coming back.
Yeah. So discomfort in your chest related to eating, especially after eating, is most likely acid reflux. Mm-hmm. And so if it is acid reflux and that has been confirmed by a doctor, then there's no reason not to have the vaccine. So please still go and get the vaccine. It won't interfere with that.
Mm-hmm. So for people that have had COVID, gotten a little bit better, but have got this long COVID, should they still go get the vaccine?
Absolutely. The vaccine is not going to interfere with anything, and having long COVID is not a deterrent or a contraindication to getting the vaccine. Mm-hmm. The only time you need to wait a longer period of time, which is about 90 days, is if you've had severe COVID, meaning you were admitted to hospital. Mm-hmm. If you've had mild COVID, you can still, 30 days you go, even if your symptoms persist. Now, the only time I would make sure that you get medical advice is if you're having persistent chest pain and you may have been diagnosed with something like pericarditis, inflammation of the membranes around the heart. Mm-hmm. Then you need guidance from your treating doctor there. But for all intents and purposes, people with long COVID does not mean you can't get the vaccine.
A big popular question that a lot of people like asking is, if you're someone that can get the vaccine, but you can still get COVID after getting the vaccine, what is the point of all of this?
Yeah, so that's a very common point that people raise. So the point of the vaccine, it demonstrates a misunderstanding of the point of the vaccine, because the point of the vaccine is not to prevent us from getting COVID, it's to prevent us from getting severe COVID, which means getting hospitalized with COVID and dying from COVID. So we're also going to get COVID, but at least we have the assurance that if you are vaccinated, you're not going to land up in a hospital and you're not going to die from COVID. And that's the bottom line and that's a major problem that we have with COVID, is people overwhelming the healthcare systems and people dying from COVID. So just because we're going to get COVID again with the vaccine doesn't mean the vaccine is useless. The vaccine was never designed to prevent COVID. It was designed to prevent serious illness from COVID.
All right, another question here from Susie saying that ever since I had COVID in August, it's like I have a long-term infection. I've got oral thrush from my mouth to my throat. It's not easy to swallow. I use salt water, but it doesn't help, and the phlegm is too much. Any advice with regards to this?
Yeah, so I would. There are some lots of drops that one can use and medicate, over-the-counter stuff for oral thrush. Number two, I would suggest that you keep on steaming. Steaming is such a good tool for COVID. At least even if you just do it every evening, take any eucalyptus preparation, put it in some boiling water, steam, and then blow. And then if you can get some chest physio, it's very, very good for the persistent phlegm, for tightness on the chest, persistent irritating cough, just opens up the chest and gets rid of all those minor little secretions in the tiny airways, which will aid your healing from COVID.
Apart from steaming, what else can patients take with regards to getting rid of that phlegmy feeling that they have even post-COVID?
Yeah, so there are some preparations that are designed to thin the mucus or loosen the mucus. N-acetylcysteine is a common one that we use with COVID. Sometimes a little bit of cortisone tablets, obviously available on prescription, can also help to loosen up the phlegm. Some of the cough mixtures that can help to thin the mucus may also be valid. Just make sure that the phlegm is clear, there's no signs of infection, you're not ill with it, and then that can help it to settle nicely.
All right, Doc, with regards to COVID, any big things that we need to look out for as we get out of the third wave but step into a fourth wave potentially later on the year? What are the big things that people need to do to prevent getting into a fourth wave?
I think, Musa, the most important thing is let's not forget the basics. Now that restrictions have been lifted, the numbers have come down, we are officially out of the third wave. There's a tendency for us to lower our guard. We have COVID apathy, COVID fatigue. So let's not forget the basics. And the basics are vigilance, ventilation, and vaccination. Keep that distance. Keep wearing your mask. Keep sanitizing. Don't forget the basics, because we will just get caught out with the fourth wave. So be vigilant, keep windows open, and please get vaccinated.
And please get vaccinated. Thank you so much, Dr. Marlon McKay, for covering all those COVID questions with us. And that is the end of that. Thank you so much for everyone that has been watching from home, all the messages, all the tweets on social media, and of course the calls that came in to ask all the doctors that we bring on the show questions with regards to our topic for the day. Cardiovascular disease, done and dusted and covered. And I hope that you'll take any opportunity that comes your way to get screened for it, to make sure that you're not at the end of the spectrum with regards to that. From me, Dr. Musa Winkosi Mtombeni, I'll see you when I see you, and remember to take care of yourself. From the Vital Science team, goodbye.